My typical workday starts around 7 a.m. The early part of our day is usually spent doing what we call morning monitoring. So these are quick appointments for our patients who are either undergoing diagnostic testing or treatment cycles. And they come in usually for blood tests and ultrasounds. So I spend the first couple hours of my day typically doing those ultrasounds and seeing patients. And then the rest of the day is spent doing a combination of follow-up consults, some other diagnostic procedures like saline ultrasounds or hysterosalpingograms, which is a test to look at the fallopian tubes. We do pregnancy ultrasounds, which is always one of my favorite parts of the day. That's always pretty exciting to see people progress to that point and get ready to graduate. And then for now, all of our visits have still been through telemedicine, the new patient appointments, and also our follow-up visits. So doing a lot of Zoom in between seeing patients, but it's a really great mix of things and really love what I do. My favorite part of my work is definitely seeing people to the finish line. You know, all of my patients have been through a journey to get to the end and to be pregnant and have their baby. And I tell people all the time that I'm well aware that typically, nobody envisions themselves in my office. It's not the first choice of where people want to end up, and I know that, and it's always kind of difficult and disappointing for people when they end up needing a little bit of extra help if they hadn't known that that was going to be part of their journey ahead of time. And so it takes a little while to kind of adjust to that. And so being with somebody through some of the ups and downs of the journey, and then being able to do that pregnancy ultrasound and see the heartbeat and listen to it and see them successfully through to the end, that is like my absolute favorite part, and that just never gets old. I have become kind of a collector of cookbooks. I really like to cook. And a lot of stuff has gone digital, and I do look up recipes online, but there's something really awesome about having the tangible cookbook in front of you. And I love looking at all the food pictures and seeing what the meal's gonna look like. And I've been doing a lot more cooking even during quarantine and during the time period of the pandemic. So that's kind of a new hobby I've picked up. I view my role really as being to shepherd the patients through the entire journey. I think it's really important to educate them and really give them a well-rounded sense of what's out there, what the treatment options are, what the diagnostic options are, so that I can help them make the decision that's right for them. Because really, it's not one size fits all medicine here. Everybody is unique and individual, and so it's really trying to learn about that patient and understand them and their goals, and to help guide them all the way through the process and help them to have a happy ending.